Hi, I'm Marissa Plesha, reporter for MedCity News. I'm very excited to be here with Siva Namasivayam, CEO of Cohere Health, and John Shreve, CEO of MCG, to talk about their new partnership. Thank you both for joining.
Thank you.
So, Siva, starting with you, can you discuss the story behind your name? I'm assuming healthcare just wasn't coherent enough, and tell us a bit more about that.
Yeah, you got it, right? If you really look at, the word coherent doesn't go with healthcare in the country today. For example, right, I went through a knee pain, right? And you go and take a MRI, and then the first physician tells you to go do a therapy, and then you still have pain, go to the next one, say that you need to have surgery, and the third one gives you some other opinion, and all three don't talk to each other, and all the medical records are not linked, and the patient at the end of the day suffers from pain. So things are not aligned properly, and there is no one path that you can take. It's all like, you go to one, they will tell you something, they won't take information from the previous person. So that's how the name, right? It is incoherent at this point. So the idea is how can we try our best to make it as coherent as possible? So that's how the name came.
Yeah, thank you so much for sharing that. And John, what really made you decide to partner with Cohere Health?
Yeah, so I'll back up a little to MCG, and we are born out of Milliman Care Guidelines and joined Hearst in 2012. And we work with most of the payers in the country, about half of the hospitals in the country. And a key application of our guidelines is the prior authorization process. And a number of the payers we work with came to us and said, hey, here's who we're talking to on this side, and we really love for their technology to be combined with the MCG guidelines so that the overall result gets us to that spot. And so that was an opportunity for us to build out on the prior authorization side, while we're actually building out on the inpatient side at the same time. So it was just a good marriage to advance both of us faster.
Yeah, that's great. And can you both tell me a little bit more about how this partnership works and who stands to benefit the most?
I can get started. The patient. I think that the most important thing when we looked at the incoherent prior authorization process today, both the payers and the providers agree that it's a patient that is getting the care delayed, because they are the ones that suffer at the end of the day. So both the parties agree that it needs to be fixed. So Cohere's idea is, how do we come up with the end-to-end technology to be able to approve things real time to the extent possible, and only focus on few things that are exceptions, right? And give it to the health plans to be able to process it or review that in-house. And in the prior authorization process, probably the most important element is the medical policy and the guidelines, right? It is so important to get the payers and the providers on the same guidelines so that they can agree that, okay, we agree that this is the right way to practice, right? That is a big task, and that's where MCG is a leader in doing that. They have 60 plus researchers that are constantly looking at all the latest and greatest developments, and they translate that and they put it in the form of guidelines, which are accepted as a third party by both sides, right? So let's get both sides, since they agree, it's probably good for us to take the content from them and translate that into, AI models and things like that that can speed up the particular process, right? Because we would rather go with something that the industry agrees is a standard, if you will.
Yeah, you probably said it all there, but the guidelines have been written over time, really, again, with the patient in mind first, just as Siva was talking about. And because it's the patient in mind first, the key thing we have is trust of both the payers and the providers. So while they're fighting with each other, they trust us. and so now we're trying to advance to the point where they're not fighting as much, but they're still basing it on the trust of the guidelines that are totally evidence-based.
Yeah, well said, both of you. And as you both mentioned, the prior authorization is kind of a controversial topic between payers and providers, and they're both kind of pointing the finger at one another. How can your solution really address that problem? Maybe see this starting with you.
As the first point, I said that it is something that's accepted by both parties, right? So suddenly now, okay, at least they are agreeing on one. The 2 or 3 things that we do with our technology is that we are trying to make sure that we reduce the time, right? So there are 3, we have over 16 million members right now and over 10 million smart transactions that kind of go through our system. What we are finding is that about 85% of them can be, as soon as the physician submits it, we can render a decision. Today, if they don't use our system, it can take anywhere between 4 hours to about 14 days, right? So that substantially reduces that. The other important thing is that both of them now can see the guidelines by which the decision has been rendered, and then the MDs always can disagree or agree, right? On both sides, right? And that always there. But the process is completely streamlined. They can do it faster. We are also finding that the providers are about, we have a NPS of 95. We measure our NPS probably for the first time in the industry, outside of the fact that they don't like prior auth. Their NPS score with the technology is about 65, and about 93% of them are highly satisfied with what they are getting from Cohere, and it makes their life easier. We also found that they can cut down on their administrative expenses by about 35 to 40%, both the payers and the providers. So that is, and then care delays are reduced by about 70%. We believe that we can shave off about 5 days out of the delays, right? For a patient, right? So that's how we are slowly advancing this area.
Yeah. And today, on the administrative side, both the providers and the payers spend their time matching up against the guidelines and then sharing it. Payers, by the way, would rather have the direct information from the EMR than they would from a case manager at the provider interpreting what's in the EMR. So getting that as a complete connection gets to a much smoother workflow for both sides while still getting the benefit of the guidelines.
Yeah, very interesting. So one last question for both of you. What other areas do your companies hope to work together on in the future?
Well, I think that we want to make sure that we deliver this in a very good way to our clients and they are happy. And we are going to put all our efforts into making sure that it's successful. That's a #1 goal. I'm quite sure for your team. I know that they are also working very hard with that. And we are making an impact in the industry.
Yeah, I think that's and actually the current arrangement, even on prior auth, is limited to certain specialties. So I would see expanding that as a key area that I would look forward to.
Yeah, absolutely. Well, best of luck to you both. Thank you both so much for taking the time and for talking about your partnership with us.
Thank you.
Thank you.